Imagine a world without medicine. There would be no way to treat diseases or ailments. There wouldn't be any way to even tell what was wrong with someone. All the surgeries and procedures that we have today would not exist. People could die from a common cold, and broken bones would never be reset or healed properly. Luckily for us, we do have medicine. Because my future career goal is to become a family physician, I am going to talk a little bit about family physicians and what their job entails. So my first main point is a description of family physicians and what they do. My second one is the education that is required to become a family physician. 3, the different levels of training that they undergo. And 4, their salary. So starting with a description of their job. Family physicians work with all different types of people. It doesn't matter their age or their gender, and they also work with all different types of sicknesses and ailments. A family physician has to have medical knowledge in all different types of the body. A family physician may go treat one patient who is experiencing chest pain and then go on to a different patient who is having problems with their foot. In severe cases, family physicians may refer their patients to a specialist whose medical knowledge is more focused in that one specific body area. Otherwise, they have to be able to diagnose and treat every patient. Family physicians have to have skills that are not just medical based as well. They have to have good communication skills. A family physician has to be able to speak well both with their nurses and staff and with patients as well. Make sure everyone's on the same page and understands what's going on. They also have to be able to work well and speak well with people and be patient. A lot of times, if patients are scared or confused, they may become angry or lash out or have a panic attack. The family physician needs to be able to stay calm and know how to diffuse the situation and help calm the patient. Family physicians are important all over the world. Luckily, here in the U.S., the family medicine and the programs involved are good, but in other parts of the world, some of the programs are lacking. According to Contribution of Family Doctors to Primary Care Research, some countries have better developed medical education programs, while others do not. In these countries with these lacking programs, less people are going into the program to become trained, and therefore yielding a lower number of family physicians. Also, according to the source, quote, countries in nearly all regions of the world are beginning to incorporate family medicine into their formal education programs, unquote. This is a very good thing and goes to show that people are recognizing the need for family physicians and trying to do something to build up the numbers. So my next point is the education required to become a family physician. So starting with college. First, one must obtain a bachelor's degree. For instance, I am going to major in medical biology. Next, one must take the MCAT and apply to medical school. The MCAT is a test taken to test one's ability and knowledge in the medical field, and the test scores are used when applying to med school. So in med school, you have 4 more years of continued education and training. According to How to Become a Family Doctor, the first 2 years consist of all classroom work and labs. The second 2 years consist of actually treating real patients while being supervised and doing a little bit of that hands-on work. After that, one begins their internship, and at the end of their internship, they take a board exam, which is another test to show how much they know about the medical field and how much they know about treating and working with patients. After their internship and passing the board exam, one begins their residency. And after their residency is when they become a real qualified doctor. Now, to become a qualified doctor, one must receive a doctorate. There are 2 different kinds of doctorates, an MD or a DO. An MD is allopathic, which pretty much just focuses on the disease part of medicine, whereas a DO is osteopathic and focuses more on osteopathic maneuvers and the structure of the body. Next is the levels of training that one must undergo. So after medical school, during one's internship, that is when the students will kind of learn under a teaching physician and start to do a little bit of hands-on work with patients. Now, after their internship, they start their residency. During a residency, they are still learning and continuing their training, but the difference between that and their internship is, one, that they start actually getting paid, and two, they'll start doing real supervised procedures on patients. A residency is the final step before becoming a qualified doctor. According to How to Become a Family Doctor, the level required to become a family physician is a doctorate. The training required is 3 to 4 years of residency, and the certification is that they need to acquire a license. Now, my final topic is salary. Now, the salary of a family physician depends on both geographical location and what type of health institution they work in. Sometimes working in more populated cities based on rural areas can yield a higher salary. Also, depending on where you work, sometimes working in a private practice may pay more than working in other health institutions. According to family physicians, the average wage of residency is $45,000 to $60,000 a year, and the average for qualified doctors is anywhere between $100,000 to $250,000 or more. In South Dakota right now, the average wage for entry-level doctors is $155,530. For medium to experienced level doctors, it is $187,200 or more. Family physicians work very hard to get to where they are, and their salary not only pays for all the work and education that they do, but all the responsibility that comes with being a family physician as well. Family physicians are in high demand, and they're very important to society, and that is a major factor in their wage. So in conclusion, family physicians are very important. They work with all types of people and go through many years of education and training to become what they are. Family physicians are very important to the medical field and have valuable skills that aid them in being able to work with all different kinds of people. If we didn't have family physicians, the world we live in today would be a very different place. And I am very excited to continue towards my goal of becoming a family physician in the future. Thank you.